To all my fellow injectors, it is time for story time case management for complications. So every once in a while when these come in, I do like to share the history of the presentation, what the prognosis is, and kind of what went wrong in this particular situation. For those of you who don't know me, my name is Dr. Stephen Soar. I'm the founder and medical director at Source of Health in Scottsdale, Arizona. I've been in practice for 10 years and doing aesthetic medicine since 2016. I'm a huge proponent of ultrasound to deliver the right tools in the right area with precision and accuracy. So this patient came to see me a day after the injection was done to help resolve the issue of vascular occlusion or a vascular event. The story is the woman went in as a model during a training at an approved and accredited place. This is nothing that is shady or anything wrong with it. It was just a brand new injector getting her skills trained for the first time. So the first place that we typically start with training is right along the zygoma at the cheekbone. So we start at the center apex and you walk our way out, or vice versa. This is just how we do it. And if it's a course, the last spot that you go to, that's just Murphy's Law, it happened to cause a vascular issue where the whole face began to blanch white and everything stopped and we went into, crisis mode. So I'm going to show you how the patient presented to me underneath ultrasound, how the injection went, and what the resolution is. I don't have any pictures of the patient because it's not my patient, and I don't have liberty to discuss that, but I will show the ultrasound. So here we go. Okay, so as you can see, we're right here. This is the zygomaticofacial artery as it's coming out of the foramen. And as I've measured here, we have a bolus of hyaluronic acid filler that is placed just superficial. This is causing an issue. So here I'm using the ultrasound guidance with our needle, and we're right into that plane and we're dissolving. You can see the fluid that's adding in here. So we're right above that important artery and below all of the other tissue. And here's the after. It has decreased in its width and it's so much better already. Capillary refill has improved significantly in just one shot. So let's preface by saying that the injector and the trainer did everything that they could to resolve the situation on their own. They even had an ultrasound, a handheld device, but it ran out of power before they were even able to really utilize it. They just kind of got started and it fell dead for them. So that's why I recommend typically using a machine like the Mindray that I have right behind me, because it works so well for what we intend to do with it. As good of an injector as you are for as long as you've been injecting, if you do not have ultrasound, this is where I'm going to come in a little bit strong and perhaps opinionated based off of my own experiences. Without ultrasound, you really are shooting in the dark. You're blind. So they used about 20 vials of hyaluronidase into the face to just flood the tissue. So I saw her the next day and there was still quite a big bolus there, and they weren't able to address it because they couldn't see it. The intention was, well, the injection was done down on periosteum, so the filler should be on periosteum. Well, as you can all see from the video and picture there, it wasn't on periosteum. It was directly above in the superficial layer of the deep compartment. And this is where they failed. And when we get under ultrasound, we can see it, we can find it, get in right in, and get out. Once I was done, so I used a total of 2 vials of Hylenex. I did one round, then I waited a little bit, and then I did another one just because it was such a large bolus right there and I wanted to give it its best shot possible. Once I was done with the second one, we did, clean everything off and we checked for cap refill. Prior to, the cap refill was many seconds long. It was looking a little bit dusky and dull. And as soon as I was done, I pushed on, waited for 10 seconds, let go. And the nurse and the injector in the room just stood back. They're like, damn, that's immediately improved. Now she has a lot of healing to do. She knows she has a lot of work to do until this resolves, but I'm not going to show any pictures of her because she's not my personal patient. But I think it's an important thing to understand that anybody can do this. It can happen to anybody, but if you don't have the proper tools in mind, you're really wasting a lot of time and energy, and the poor patient's suffering in pain. So this is why I recommend ultrasound in your practice. If you don't have ultrasound and you're interested in it, in learning more and getting trained in it, I am here for you as a resource. There are other injectors, there are other trainers around the country. I really encourage you all to look into it a little bit more. It is worth the investment, and it is better to have and not need than need and not have. Thanks for watching. Please ask me any questions that you have. I don't want to get into like all the products and who's right or who's wrong. This is just a safety issue and how to resolve it as quickly and efficiently as possible. Thanks.